Why are children's sinus cavities prone to sinusitis infections? Imagine tiny air pockets in your child's face that are still growing and changing. These are the sinus cavities, and in children, they are more likely to get infected. This is because their sinuses are still developing, which affects how they look and work. When babies are born, all the sinus cavities are there, but they are not fully formed. The ethmoid sinuses are somewhat developed at birth, but the maxillary and frontal sinuses grow much later, usually starting around ages 3 to 5 for the maxillary sinuses and closer to 5 or older for the frontal sinuses. This ongoing growth means the sinus cavities are smaller, narrower, and have less effective drainage pathways compared to adults. Because of this, children are more vulnerable to sinus infections. The openings through which mucus drains, called ostia, are smaller in children. These small openings can easily get blocked by mucus or swelling, trapping bacteria inside and leading to sinusitis. Also, since the sinuses are still expanding and not fully air-filled, the lining inside is thicker and more reactive, which can cause more inflammation and make infections more likely. Children often catch colds and other viral infections that cause nasal congestion and swelling. This congestion narrows the sinus drainage pathways even more, making it easier for bacteria to grow and cause sinus infections. Plus, a child's immune system is still maturing, so they may not fight off infections as effectively as adults do. The close proximity of the ethmoid sinuses to the nasal passages also makes it easier for infections to spread from the nose to the sinuses, especially since these sinuses are relatively more developed early on. Most often, sinus infections in young children involve the ethmoid sinuses because the other sinuses, like the maxillary and frontal, are still developing. As children grow older, their sinuses enlarge and mature, which can change how often they get sinus infections and how those infections present. Understanding this development helps doctors recognize why sinusitis is common in children and how to treat it properly. It also explains why sinus infections in kids can look different from those in adults. Always remember, if your child shows signs of sinusitis, such as nasal congestion, facial pain, or fever, it is important to consult a healthcare professional. They can provide the right diagnosis and treatment to help your child recover safely.